I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
Because we don't trust y'all. We don't trust y'all in no career path.
Hey beautiful people, how y'all doing today? It's your girl Destiny here and welcome back to my channel. How you are doing? Hope you guys are doing great. So today's video is a very interesting video because this conversation needs to be had, and I feel like it's going to educate some people and everybody's just having a conversation. Yeah, okay. So this video is a video of a white medical ER doctor who came online to ask a question to the black community. I wanted to ask, why is it that when an African American person is in the emergency room or seeing a doctor, they are always on the phone, FaceTime with another person on the phone? And he was like, for him, when he's seeing a doctor and the doctor walks in, he automatically cuts the phone and no distraction. But most African American people always have their phone out and they're always on the phone with someone. So it's almost like there's a third party in the conversation room. And he was asking that he genuinely wants to know why this is. And this hasn't really sit well with a whole lot of people. I need you guys to see this video. Just see the video, then we'll come back and talk.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist. I've gotten backlash before online, and it's horrible. But here we go. I've been an ER doctor for 10 years now, and a significant amount of my African American patients, while I'm doing a history and physical to understand better what's going on with their problem today, they have someone on the phone. They're either just talking on the phone or they're on FaceTime, but a large percentage of my African American patients have someone that's there in the room even though they're not there in the room. Why is that? When I, myself, not speaking for an entire race or ethnicity, have a doctor come in, I hang up my phone. Am I an outlier, or is this a trend that other people have recognized? Also, if you are from the African American community and you do think that this is a thing as well, why is this? Is this for emotional support? Is this to make sure that they're being treated fairly? I genuinely am curious, and I'm really hoping I don't get backlash for this.
So that video didn't sit with a lot of black people, and they've called him out like he's literally been dragged and educated on social media. So that video has been deleted. So that's why it almost seems like bits and pieces being patched in the original video. So pardon me on that. But let's go hear other people's thoughts on this, what they think about what he said and their response and what their educational thought is.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
So this doctor goes on to ask why so many of his African American patients tend to be on the phone or have someone on FaceTime with them when he comes in for their appointment. The question to me honestly seemed disingenuous. It would be completely reasonable to just ask the patient why they have someone on the phone, especially since it happens so much to this doctor. But anyways, here's an answer. The reason your African American patients have someone on the phone or on FaceTime with them when you come in for their appointment is the same reason I bring my white ex-husband to all of the doctor's appointments he can possibly make. I need a witness. I need an advocate in case this doctor says or does something off the wall, because that's happened to me dozens of times as a chronically ill disabled black person. I hate going to the doctor by myself unless it's a doctor I've already seen multiple times, because I have no idea when I'll be abused, gaslit, mistreated, talked to poorly, or just downright disrespected. When I gave birth to my son at 21 years old, my OBGYN was stitching me up and he said, "I bet you won't do this to yourself again." A white man. When I took my son to the doctor because I needed a referral to genetics because he needed to be tested for a disease that I carry, a genetic one. Our usual pediatrician wasn't in, so I saw her replacement for the day, and that woman thought I was making up an entire disease. A white woman. Couldn't even bother to Google it. Do you know what they call a person who graduates at the bottom of their class in medical school? Doctor. And I've met a lot of bottom of the class doctors, and they typically look like you.
History and physical to understand better what's going on with their problem today. They have someone on the phone.
Oh, I can answer this. It's because y'all will lie. Y'all will lie, y'all will say, y'all will mistreat people, y'all will prescribe things, y'all will do things, procedures to people, and y'all will lie about it. The moment that they have a negative reaction to something, you will lie about it. And this is not about something that I've heard. This is something that has happened to me because, as I've stated before, I am a cancer survivor, which means I went through chemo and radiation. When I went through radiation in Memphis, Tennessee, at St. Francis Hospital, there was a woman, I don't remember her name, but she literally told me, on that day, we're going to attack this. We're going to attack this directly. We're going to be very aggressive towards this. And the day, literally that same day, I had a negative reaction to the radiation. And when I came in and I asked her for pain medication because I literally could not walk because of what she did to me, she then told me that she never gave me radiation. When I sat in the machine, she stepped out the room, she fitted me for a cast, and she turned the machine on because she had to step out of the room while the machine was on, and lied about it. Lied to my face and told me what she did not do to me. The reason that we have people on the phone and the reason that we are recording y'all and things like that, because you will lie. You will protect yourself, and you have a problem with us protecting ourselves because you all lie. You will lie to protect your license. You will lie to protect your reputation. You will lie to avoid accountability and being sued for malpractice. You will lie. And because majority of the time, a lot of people who are treating us are not black. They are, most of the time, they are white and non-black people of color. And all of y'all, I don't care what you say, you have it in the back of your mind that black people do not feel pain at the same rate as you. So y'all feel emboldened to do whatever you want to do when it comes to black people and dismiss their pain. Y'all will lie.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
Did you really go all the way through medical school without learning who J. Marion Sims is? Like, do you really want to sit here and play on our face and pretend like you don't understand that systemic racism also is deeply rooted within the medical industrial complex, and accountability is a big part of why black patients are going to be on the phone while you're there? And you also know that this question is playing off of stereotypes around black people being loud and like disrespectful in public places. So the purpose of the video was to get a bunch of clicks and views so that a bunch of white people agree with your microaggressive nonsense, and then to get well-meaning black professionals to treat this question as if it deserves any kind of dignity or respect. Do better.
But a large percentage of my African American patients have someone that's there in the room even though they're not there in the room. Why is that? When I, myself, not speaking for an entire race or ethnicity, have a doctor come in, I hang up my phone.
I am deeply disappointed in that video. Instead of talking directly to your black patients and trying to understand why they may do or not do something, you took to social media and made a sweeping generalization about one of the most oppressed and hated populations in the country, opening up your comment section to be unsafe for black people. So in this video, you said you were scared of being labeled as racist. Well, I'm going to challenge you to do something anti-racist. I want you to talk to your black patients to make a point to really understand. And I want you to research how medical trauma and racism impacts black patients' care. And then I want you to stitch your original video with what you've learned. That is how we move forward, and so videos like the one you made don't get made again.
A large percentage of my African American patients have someone that's there in the room even though they're not there.
I'm going to answer this in good faith because I assume you mean well. But before I do, when in history was the medical field trustworthy towards African Americans? The medical field has consistently tested on it without our consent, and it has never benefited African American people in any way. We never even got an apology. Even our maternity rate is abnormally high. Like, honestly, this was like on purpose. But you want to know why African American people don't really trust medical doctors? You almost took out one of our legends because you thought it's impossible for her to feel pain. And where did you learn that lie? Where did she learn that lie? The lie that black women has a high tolerance of pain. Could it be from the founder of gynecology? And what's even crazy, you guys have even tried to update the book. Took this mad scientist's words and just ran with it. Oh yeah, they can't feel pain. A slave owner said it. And just recently, I actually have a doctor working on making sure that we're represented in the textbooks. Doctors like you can know what to look for on this skin and this one. So until the medical field is changed systematically, my bestie's gonna be on that phone Googling whatever you said.
A large percentage of my African American patients have someone that's there in the room even though.
Hey, Dr. J. Mac. It's really simple. The reason a large percentage of the African American population has somebody on the phone or on FaceTime when you come in to do a history and physical is simply to bear witness. You, as a white male, do not have to worry about that because you are going to get taken seriously. You're not going to face any racial bias, any racism, whereas African Americans, well, I don't need to go into the details, but I think you get it.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
So this right here is a prime example of why I think there are certain professions that should not be allowed to make monetized content online utilizing their professional identity, especially if that professional identity has an ethical code that they have to uphold. He didn't ask this question in good faith. Oh, I have a question, and I'm just a white guy asking a question. Black people, you know those blacks, they're just so hard to figure out. He asked this question for the sole purpose of going viral. He knew exactly what to say. That's why he prefaced that video in the beginning, because he knew that he could get your attention. He's going to ask this dumb question, because he knew it was going to generate content. He posted the same video on his Instagram. Has the comment section wide open and got people going back and forth. He knew what he was doing. The man who went through a medical school program within the last 20 years, he should not be asking this question. If you're going to ask this question, why would you ask it of the internet? Be serious.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
This reminds me of a post that I just shared to my story yesterday, and it was from last year. Y'all remember when the girl was like, my black friend got her hair done. How do I ask her about her hair without it seeming racist? This is the exact type of scenario. And in that I responded, maybe just ask her like you would anybody else. My thing is, and my question to you, sir, I can't even remember your name. Do you not know any other black doctors or black people to ask this question to? And are you not aware of how the health system is in the U.S.?
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
Because we don't trust y'all. We don't trust y'all in no career path. What? Is that a real question? Of course my mama got to be on the phone if she's not in the room with me. Of course my sisters have to be on that same phone call. It's a group message, actually. Of course there are going to be 14,000 people who know what's going on. Are y'all not paying attention? Like, are you really not paying attention? Was this a genuine question? Like, are you really not paying attention to black people when we speak? You know what? I know the answer.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
First off, too late, buddy, because you're going to the internet instead of talking to any of your black colleagues, looking at any of the research around things like black infant mortality or maternal or gestational mortality rates. I mean, you could also just look at media and look at Serena Williams' interview about her experience with pregnancy and how she almost died. And she's rich. But instead of acting like you could have done any of those things, let me give an example. Early in 2023, I f***ed my rotator cuff in my shoulder. It was at a level that holding my cell phone felt painful and my arms were visibly different length hanging against my body. And I was in pain 24/7. I reached out to my primary care physician who simply told me to ice it and take aspirin because he didn't think it was worth an MRI to see if there was an issue. 2 weeks and a lot of customer service complaints later, I had rotator cuff injuries in 2 different parts of my shoulder. I always bring folks with me now.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
So he asked why a lot of his black patients are on the phone or on FaceTime when they are at the doctor's office being seen. And I think a lot of it is a comfort thing. If they can't have somebody physically there with them, then they feel a lot better having somebody on the phone with them. Also, just having somebody to bear witness to what's going on, because a lot of times doctors will ignore black pain. And I think a lot of that goes back to slavery and slaves being beaten and still being made to go work through their pain. Now, just because we go to work with the pain does not mean that the pain is not there. And I think because we continue to do a lot of things and we're not on the floor and we're not performing for them. We're not looking like we're just in such agony and holding our stomachs and, in a ball on the floor, that we're not believed. But it does not mean that the pain is not there. A lot of Black people back in the day lost their lives because they wouldn't be seen at certain hospitals. They were refused service and had to go to another hospital, and by then it was too late. So that distrust has been there. On top of that, they're racist in every industry. And there was this guy on here a few days ago that was talking about how he met this retired firefighter, and the firefighter was talking about how back in the day they would just let Black families burn up in house fires and stuff like that. So I definitely believe that the racism, while it may not be blatant anymore, it's just transformed into something quieter. And I do think that there are doctors that do not care about their Black patients and will misdiagnose them and will, try and redirect them or dismiss their pain so that they can just go off and just pass away because they just don't care. So we very much have every right to be suspicious of doctors.
One that's there in the room even though they're not there in the room. Why is that?
Because we don't trust you, Bradley. We don't trust you. We are painfully aware of the ingrained racism in the medical institution. We are painfully aware of that, from the macro to the micro. So when we walk up in these and we're telling you about our symptoms, we know that you are probably not going to listen to us. You're probably going to tell us that what we are feeling is not what we're really feeling. It's anxiety or diabetes or some stupid shit. While you're busy stabbing the fuck out of us with a syringe because you don't believe that Black people's pain threshold is as low as everybody else's. Millions of Black people have died at the hands of millions of doctors and their negligence towards Black health. So we're going to be on this phone while we do this little checkup. And to keep it a stack, we would prefer to have that person in the room physically with us. But we run the risk of you saying some out-of-pocket. That person trying to help us advocate for ourselves, and if they say something a little bit too loud for your liking, the cops are called. It's dangerous. That's why. It is dangerous to be around y'all. Black patients are aware that you are not trustworthy. We are also aware that you don't care that we don't trust you. And we know that you are intellectually incurious enough to not even want to change that. That's why. That's also probably why people think that you're racist when you ask questions like this. I'm just saying, just throwing that out there.
I have a question, but I'm afraid to ask it because I don't want to be labeled as a racist.
Anytime you have to start a video with, can I ask a question, but I don't want to sound racist, just know that you're probably asking something that's a little racist. So the question that this physician asked is, how come when I work in the hospital, all of my African American patients are always on the phone or on the video during the whole exam when I'm trying to do a history? Like, what's up with that? I only see it with them. Can someone tell me? I would suggest asking your patients. First of all, no person can speak for an entire race. So why you're asking people to do that is odd. Two, I want you to look at the privilege behind being able to go into a doctor's office and not need your phone, not have to call anybody, and know and trust that you're receiving adequate medical care. Because historically, right, we'll just go on history, we won't talk about current day events. Historically, the medical system has not been, how do we say, friendly towards people of color, towards Black people, towards indigenous people. So perhaps one of the many reasons someone might be on the phone when you're trying to take a history is they don't trust you. They don't trust you. I mean, there's really no other way to break it down. I would suggest maybe like taking a little bit of a history class, looking up the Tuskegee syphilis experiments. Those ones, pretty great reasoning for why people of color, African Americans, Black folks might not be so willing to be alone in a room with you. Or how about
what a lot of people still call the father of gynecology, Dr. Sims. Yeah, why don't we take a look at what he did to African American women specifically, and how he bought slaves and used them for medical experiments. So, yeah, that's like one of the many, many reasons your patients might be on the phone. Something you could do is just say, hey, I'm your doctor. I'm here to perform X, Y, and Z. I see that you're on the phone. Would you like to keep them on the phone while I do X, Y, and Z? And that person will be able to tell you. And that, my friends, is informed consent. So yeah, you did sound a little racist.
African American people are currently and have historically been mistreated and endangered by the American medical system. I posed a question to the internet yesterday about an observation that I had made as an emergency medicine doctor, that a disproportionate amount of my African American patients were on their cell phones during medical encounters. And I thought I knew the answer, but I asked why. And there were a lot of people that were upset that I would talk about this on social media, and they were upset that I wasn't talking directly to my patients about it to get the answer. And I 100% get that. I should absolutely be doing more in my personal practice, in my immediate environment, to help make the medical environment a safer place for Black people. It was my hope that by making this video, I could reach a lot more people than I can reach in person, and address the fact that there are a lot of people who think that it's rude to be on the phone during a medical encounter. But it was my suspicion that this was rooted in very justified mistrust and fear of the medical system. To everyone that I have triggered and offended, I apologize. It is my genuine goal in life to spread positive ripples throughout the world, and it appears I have missed the mark with this.
Please go down in the comment section and share your thought. Love to know what you think about this down in the comment section, but please keep it respectful. You're on this channel. We are allowed to disagree, but we do it in a respectful way. So go ahead and share your thought. So for me personally, like, I feel like this, even me, I am not an African American, but I know some of the struggles they go through. I may not get everything, but I know. And with the type of information that is out there on social media and out there, I feel like this question was really not genuine, because there's so many resources and so many, how there's a video Anti-Karen on TikTok where she was literally locked into a room because she was trying to defend another Black woman in the hospital. And imagine how the entire story could have been spilling around if she didn't have a camera on. So for him to come and be asking, oh, I don't know why African Americans like, and I can bet you it's not all African Americans that does that. So him coming to say why African Americans, not saying some, or just literally saying African Americans, they're always on the phone. I'm just like, why would you do that? And seeing the type of record that's already out there, that Black people barely feel pain, and Black people are not even treated half as nice as they treat other race, why won't Black people protect themselves by recording, filming, making sure somebody is there? Because something can just easily switch, and their story, they won't even believe the Black person. I posted a video of Dr. Jackie even saying it about how Black people cry wolf. I just did a video a couple of days ago, and somebody's asking, with the old Dr. Jackie thing, oh, Black people are cry wolf sometimes. You are asking why Black people go into the consultation and they have their phones out. I just find this question very disgenuine, like it's not. And I agree with that creator that said that he knows exactly what he was doing. He knows he was going to pull clicks and views and all that, yes. Even though he has taken down the original video, it was because of the heat he was getting. He knew exactly what he was doing. Anyway, guys, please go down in the comment section and share your thought. Love to know what you think about this conversation down in the comment section, but please keep it respectful. Go on and share this video with somebody that you want to be part of the conversation, because that's what we do here. We have banging conversation. So go on and share this video. Don't forget to give this video a thumbs up, smash the like button, because this helps YouTube to push out my content for more people to see, and that will be you supporting your girl. With that all said, guys, I will see you guys in my next video. Deuces.